My name is Jill Bowen, CEO of Northwestern Medical Center and your host of the NMC Health Beat Show, dedicated to discussing important healthcare topics of interest to our community. Today, I'm joined by Dr. Haitham Nsour, a new addition to our team at Northwestern Pulmonology, and we're going to be talking about the services that he provides to our community. So thank you so much for joining me today, Dr. Nsour.
Good morning, and thanks for inviting me.
It's so wonderful because pulmonology, we've sort of patched together a little bit. So the fact that you're here in this community with full service offerings, we couldn't be more excited. So
thank you.
I'm sure the community is going to be really excited to hear about you. So before we start with what you actually do, maybe tell us a little bit about who you are, your education, your experience, your background.
Thank you. Well, I went to medical school in Jordan, my native country, and then came to the United States to pursue further training in medicine. I started with training in internal medicine, which is a prerequisite for training in subspecialties in medicine. After that, I went on to do 2 fellowship trainings in pulmonary and critical care medicine and sleep medicine as well. After finishing my training, I joined a private group in New York State, and in 2012 decided to move to Vermont. So I've been living in Vermont for the past 6.5 years, and am very familiar with this part of Vermont and both Chittenden and Franklin counties. So.
Oh, terrific, thank you. So tell us, what do you treat? What is your practice like?
Well, pulmonary medicine is a broad-based specialty that requires a knowledge in internal medicine, and it provides services to people with breathing diseases. The lungs can be primarily affected by a wide variety of lung diseases. At the same time, they can be affected by other systemic diseases where the lung is a secondary or an innocent bystander, so to speak. We provide general pulmonary services that takes care of patients with common breathing disorders like COPD, asthma, and also lung cancer. We also provide services for patients who require somewhat of a highly specialized pulmonary care, like patients with interstitial lung diseases and pulmonary hypertension. We will also help coordinate the care of patients who would require services that we don't have at Northwestern Medical Center, like patients who require lung transplantation.
Oh, wow. Fantastic. So in order to come and see you, do they need to see their primary care provider first, or can folks see you directly and make a direct call? How does that work? How do they access these services if they have concerns about breathing?
Well, it can work both ways. There are some patients are referred through their primary care providers, and some patients, they call us directly. I think at times it depends on the patient's insurance plan that may or may not require referral from a primary care provider. But we're open for appointments Monday to Friday every week. And we take direct referrals and direct or self-referred calls as well.
Great. And where are you located?
We're located at the main Northwestern Hospital campus at 133 Fairfield Street in St. Albans, Vermont.
Great. Right at the front of the campus, easy access for those needed with breathing problems.
Exactly. I mean, the clinic is conveniently located very close to the main entrance of the hospital.
Great.
And as I said, it's the main and primary location for our services.
Super. And we can remind our viewers that we have valet parking, so if they're having difficulty getting to the front door, or we have a shuttle as well. So that makes it easy to get to you, especially with those breathing conditions.
Sure.
So What about COPD and lung cancer? What are you doing? You mentioned that on your list. Tell me a little bit more about that treatment.
Well, as you know, lung disease is the third leading cause of death and mortality in the United States, right behind cancer and heart diseases. So it's a common problem, and patients with COPD by far represent the majority of those patients at risk for death due to lung disease. COPD stands for chronic obstructive pulmonary disease, which includes two main categories of disease processes that include chronic bronchitis and emphysema.
Okay.
In general, when we breathe in a normal person, the air travels through the windpipe or the main airways that branches into smaller and smaller network of branching airways, and that will end in the air sac. The ability to breathe normally depends on the ability of the airways and air sacs to expand, to allow the air to get into the lungs, and then to bounce back to their normal size after we exhale. Unfortunately, for a lot of patients with COPD, that ability for the airways to expand and bounce back to their normal size is abnormal, which makes it harder for them to breathe out. A lot of those patients, they also have swelling and inflammation of the bronchial tube, which produces more sputum, and that can clog their airways, adding to the problem of breathing. So a lot of those patients, they experience symptoms like shortness of breath, chronic cough and wheezing. And in the early stages of the disease, they may have minimal symptoms that may only be shortness of breath at the higher levels of exertion, or chronic morning cough that a lot of smokers refer to as smoker's cough. So this is not a normal thing. And this, again, may represent the early symptoms of COPD. So, unfortunately, we cannot cure COPD, but it's manageable. And in many cases, it's preventable. The great majority of patients with COPD get their disease secondary to tobacco smoking, about 90% of the time. Less than 10% of cases are related to chronic exposure to fumes, irritants, or other occupational exposures. And in a small percentage of patients, it's genetics, where rare conditions that are passed on to them through their genes can predispose them to developing COPD, whether or not they're smokers. And at Northwestern Medical Center Pulmonary Clinic, we routinely screen for those rare genetic conditions that can predispose patients to develop COPD.
Wow. Thank you. That was a great description. And for those that are smoking, I mean, it's a real, call to act, and because we can prevent this largely, and the smoking is really something we can control.
Absolutely. I mean, in this day and age, with a vast array of tobacco products that aim to lure the next generation into becoming dependent on tobacco, like the electronic cigarettes, I think a major part of what we do is education and increasing the public awareness of the danger of these products. For those who already have COPD, part of the management, aside from medications, is behavior change and lifestyle modification, which has become a key part of the management of COPD.
Absolutely. So pulmonary rehab. So if someone does have the disease, tell me a little bit more about our pulmonary rehab program at Northwestern Medical Center.
Well, we're excited to have this program, which is somewhat unique to a hospital, the size of Northwestern Medical Center. Pulmonary Rehab is a comprehensive intervention program that aims to improve the health, both psychological health and well-being of patients with chronic lung diseases. The whole process starts by selecting those patients who can potentially improve and benefit from this program. After that, they go through a thorough evaluation process, which we call phase 1, that includes physical therapy and sort of studying the patient's needs as part of this program. After the initial phase, they go through a patient-tailored physical therapy and rehabilitation process that would include exercise, education, nutritional counseling.
Oh, fantastic.
And again, all these interventions that will promote long adherence to these lifestyle changes. So it's not limited to the duration of the pulmonary rehab program itself, which lasts for up to 36 sessions per patient.
Wow.
Can be also expanded in some cases. It is indicated for patients with COPD. It's also indicated in patients with interstitial lung diseases and pulmonary hypertension. And I have to mention that it's also part of the pre-transplant evaluation process for patients who are being considered for lung transplantation. So again, most of the transplant programs would require their patients to go through a pulmonary rehabilitation process before they become eligible for lung transplantation. So we're excited to have this service. It's really important and has become an integral part of the holistic care of patients with chronic pulmonary diseases.
Fantastic. Now, I understand also we, at the Northwestern Medical Center, we have the ability to do like a lung scan?
Yeah.
What is that for?
As I mentioned earlier, lung disease is the third leading cause of death, and lung cancer is the leading cause of cancer death in the United States.
Wow.
So, unfortunately, despite the extensive research, we don't have a biomarker for lung cancer that can tell us about who's going to get lung cancer, or that can be used as a screening method. So at Northwestern Medical Center, we're designated as a lung cancer screening center, where we provide low-dose lung cancer screening scans for those patients at risk for developing lung cancer.
Fantastic.
And this has been adopted after a large study that was published in 2011 that showed significant reduction in lung cancer mortality in those patients who are screened for lung cancer using this low-dose screening method. So we do have that. It's an open access program. Patients can have the scan ordered by their primary care providers and also through the pulmonary clinic at Northwestern Medical Center. We're available to counsel those patients about the results of their scans and arrange for the next step accordingly. But it is an important resource that we do have at Northwestern Medical Center.
That's fantastic. This is so comprehensive, and we could talk for a lot longer, but our time is already coming to a close. And I'm thinking, sort of, what's next? It sounds like you're just with us. You've got all of these offerings, and what do you see coming over the next year or so? Well,
we're excited about the potential for expanding the services that we have. Again, it's not about treating individual patients or individual diseases, but it's about implementing measures and interventions to prevent lung diseases and increase the awareness of lung health. In addition to that, we're also excited about the potential for starting comprehensive sleep services at the Northwestern Medical Center Pulmonary Clinic, hopefully within a year. where we can take care of patients with a broad spectrum of sleep disorders, including insomnia, sleep disorder, breathing, and also increase the education about sleep health as well.
Fantastic.
This is very important because of its implications on drowsy driving, reduced productivity at work, and the overall life style of patients.
Thank you so much.
You're welcome.
I can tell you're going to be back on this show. You have so much more to talk about. So thank you very much for being with us. We'll wrap up this session. I'm Jill Bowen, CEO of Northwestern Medical Center, and your host of the NMC Health Beat Show. You know, the message today is when you think about your lung health, first and foremost, smoking. Make sure you're not smoking. I think it's imperative. And if you do have some lung concerns or breathing concerns, we now have a very comprehensive program. Thank you, Dr. Nsour.
Thanks for having me.
It's a pleasure. And thank you for joining us today.